There is a mysterious condition first noticed among Polynesian pearl divers called Taravana. The word means to fall crazy or to lose one's mind. And that's basically a freediver's version of Ben. Let's check a medical report. 57 years old man, underwater fishing champion, non-smoker and previously in a good health, started to dive session. Condition optimal for diving, he performed 19 dives to a mean seawater depth of 30-35 meters, around 150 minutes. During the 16th dive, a frontoparental pain occurred and he complained dizziness, blurred vision, and sensory numbness. Next day, he was promptly admitted to the emergency and critical care room with a Glasgow Coma Scale score of 5, that means severe impairment of consciousness. The syndrome was first described in 1956 by Dr. Drup, who observed neurological disorders among pearl divers in Tuamotu Island, French Polynesia. These island divers spend their day diving for black pearl, hundreds of dives per day in depths of 30, 40, even 60 meters. No scuba tank, no dive computer, just their lungs, and no idea about surface intervals. Many of them began to show strange symptoms: dizziness, confusion, slurred speech, even paralysis or loss of consciousness. They called it Taravana. It looked like a stroke, but the cause was pressure. So what really happened? The pathophysiology of Taravana syndrome is still debated, but the most accepted theory that it is a form of decompression sickness, neurological type. Even though freedivers don't breathe compressed gas, the air already inside the lungs gets compressed as you descend. At 30 meters, the pressure is about 4 times higher than at the surface. That means that nitrogen in your lungs becomes 4 times more denser and it becomes more soluble and starts to dissolve in your blood and tissues, moving from where its concentration is higher in the lungs to where it's lower in the bloodstream. Normally, this isn't a problem because nitrogen dissolves slowly and during short dive, just a teeny amount enter the body. But if you dive repeatedly with short surface intervals or stay deep for a long time, nitrogen begins to accumulate. So your body doesn't have enough time to release it back into the lungs before your next dive. And over the time, microbubbles of nitrogen can start to form in your brain capillaries, leading to symptoms similar to decompression sickness in scuba divers, similar but still not the same. The syndrome is characterized by the onset of neurological symptoms after deep or repetitive dives. The main manifestation is cerebral, stroke-like symptoms, or cognitive impairment. You might feel dizzy, clumsy, or slow to react. Your vision blurs or your speech becomes slurred. Some divers describe it as feeling drunk underwater, and in severe cases, it can cause partial paralysis, unconsciousness, or even permanent neurological damage. MRI findings often show real structural changes in the brain. So let's look at the medical case again to understand what mistakes the diver made. Each time in depth lasted 2 till 2 minutes 50 seconds, and the surface intervals between dives were just 1 minute to 1 minute 30 seconds. And also, after he got his first symptoms, he just called the doctor but didn't go to the hospital because of symptoms regression. He didn't allow enough surface intervals between dives, which lead to progressive accumulation of nitrogen and eventually triggered Taravana syndrome. And also, his mistake was not going straight to the hospital right after his first symptoms appeared. Probably he underestimated them or didn't realize what they could mean. There's few risk factors for microbubble formation. Dive deep repeatedly around 30 meters, long time in a depth or higher depths, don't have enough surface intervals, rest too little on a surface. Standard is you should have a rest 2 or 3 times more longer than your dive duration. And also coldness, dehydration, fatigue, and intense physical exercises. And mixed breath hold with a scuba session in a 1 day. So each of these slow down nitrogen elimination or trigger nitrogen to absorb faster from the lungs, and both of them increase microbubble formation. And here is the good news. Based on data, Taravana syndrome is really rare and completely preventable. So to stay safe, rest 2-3 times longer on the surface than your dive duration. Stay hydrated. Nitrogen dissolves more easily in dehydrated tissues. Postpone dive if you not feel good. And never dive alone. Use dive computers to track surface intervals.
So, what was the outcome of the case with the underwater fishing champion? He underwent hyperbaric oxygen therapy sessions and stayed in neurology ward for 10 days. The patient has completely recovered from the neurological deficits. He restarted his diving activity as a great underwater fishing champion.
Freediving is all about balance between depth and recovery, about effort and patience. It's not just how deep you go that matters, but how wisely you come back up. So, dive safe. And don't forget to subscribe if you want to explore freediving from medical point of view.